Good evening. My name is Angela Lafferty, and this is the case of hyperthyroid disease or Graves' disease. Today is October 30th, and this is nursing 711. So for this case, this was a 52-year-old man who was on his normal morning jog and began to feel dizzy, became short of breath, and experienced some palpitations. Due to the intensity of his symptoms, he decided to sit down. And at that time, he felt a fluttering sensation in his chest that alarmed him enough to call 911. So after arriving in the ER, he reported to us that he had an unexplained weight loss over the past 4 months of about 15 pounds, that he stated that his heart often feels as though it beats too fast and too hard, even when he's at rest. And he denies having any chest pain with episodes of palpitations, but that he noticed that they are increasing in frequency. The patient also reported a new difficulty swallowing some foods over the past week and had planned to make an appointment with his doctor to have this issue addressed. His wife also informed us and shared that he had been more irritable recently and she noticed a change in his normal behavior. So his past medical history, it includes chronic migraines for 9 years, recent herpes simplex infections to his lips that have increased, and hypertension in the last 3 years that is being treated with medication. So overall, this clinical picture suggests a systemic process affecting his cardiovascular, metabolic, and possibly neuromuscular systems. The combination of unexplained weight loss, heat intolerant symptoms, palpitations, and mood changes strongly raises suspicion for an overactive thyroid, so consistent with hyperthyroid disease. So hyperthyroidism is a disorder where the thyroid gland produces an excessive amount of hormones, T3 and thyroxine or T4. So the hormones control the body's metabolic rate, and when it's overproduced, they accelerate many systems. So this acceleration causes symptoms such as the rapid heart rate, unintentional weight loss, heat intolerance, and anxiety. So hyperthyroidism also can be called Graves' disease. However, there are some other diagnosis that fit into that diagnosis of hyperthyroidism as well, but it often presents around age 30 to 50, but it can present sooner or later, but that's the average age. Risk factors include family history of thyroid, autoimmune disease, high iodine exposure, cigarette smoking, which can worsen symptoms, and eye involvement. And 60 to 80% of the cases of hyperthyroidism are Graves' disease. To make it easier to understand, I like to break it down a little like this. Graves' disease happens when the body's immune system gets confused and starts attacking the thyroid gland. The thyroid's a small gland in the neck. It's butterfly shaped. The gland controls how fast your body uses energy, i.e. your metabolism. So instead of slowing it down, these immune signals called antibodies trigger the thyroid or trick the thyroid, into working too hard. That means that the thyroid will make too much thyroid hormone, causing the body to go into overdrive. It would be like pushing the gas pedal in your car and it getting stuck. So when the thyroid is overstimulated, the process in the body speeds up. This speeds up the heartbeat, speeds up your heart beats faster. You have weight loss for no reason due to the increase in metabolic rate. You have feelings of anxiety, you sweat more, have trouble sleeping. These are all parts of the disease process in regards to hyperthyroidism. So, on a cellular level, a lot is going on. Graves' disease begins with an autoimmune response. So, the body mistakenly produces antibodies called thyroid stimulating immunoglobulins, or TSI, which act like thyroid stimulating hormone, or TSH. So, the antibodies attach to the TSH receptors on the thyroid follicular cells and continually signal them to make more hormone when the body does not even need it. So it's tricking your body. The thyroid responds by becoming overactive and enlarged and releases a large amount of T3 and T4 into the bloodstream. So once the hormones reach the target cells, T3 enters the cell and binds to the thyroid hormone receptors in the nucleus. So the interaction changes how certain genes are expressed. leading to the production of proteins that cause an increase in energy metabolism. So all of this autoimmune activity triggers a chronic inflammatory response within the thyroid tissue. There is an activation of T helper cells and B cells, which release cytokines such as interleukin 6, a tumor necrosis factor alpha, and which then they recruit more immune cells to the site. The sustained inflammation leads to tissue remodeling, vascular congestion, and sometimes eye and skin changes. Graves' ophthalm- ophthalmopathy, ophthalmopathy, sorry, and dermopathy. So on the side are a few of the systemic effects of that Graves has on the patient: the faster heart rate, weight loss, tremors, anxiety, and heat intolerance. But the best way to understand Graves' disease makes the immune system accidentally push the gas pedal all the way down, like we talked about before. So every cell in the body is now running on high gear. So the clinical manifestations. So the chief complaint, of course, of this 52-year-old male, he presented to the ER after an event on his morning jog. He had palpitations while jogging with shortness of breath. He complains of difficulty swallowing with fatigue and heat intolerance and irritability. Now, the difficulty swallowing is probably from an enlarged thyroid, which we discuss later in his physical exam. So he has unexplained weight loss. On physical exam, the patient appeared thin, with fine hair, mild bilateral proposis, and eyelid lag, all characteristics of Graves' disease ophthalmopathy. His thyroid gland is enlarged on examination, tender and consistent with goiter formations. Cardiovascular assessment revealed an irregular rapid heart rhythm, a sign of AFib associated with excess thyroid hormone level. So diagnostic testing confirmed these findings. His ECG revealed atrial fibrillation, sinus tachycardia. Thyroid ultrasound demonstrated marked vascularity, and the radioactive iodine uptake test shows elevated up to 53% uptake, consistent with hyperfunctioning thyroid tissue. So the presence of TSH receptor antibodies verified the autoimmune etiology, and the exophthalmometry explained or confirmed the significant eye involvement. So his past medical history includes hypertension, recurrent HSV infections on his mouth, and notable family history of thyroid disease. He has had severe emotional trauma concerning his recent loss of his daughter, and this is a potential trigger for autoimmune response. He was a smoker but quit 11 years ago, and he consumes a lot of caffeine currently. So some diagnostic tests we did where we confirmed the findings with his ECG. Again, we revealed AFib and sinus tachycardia, which is in line with the diagnosis. The thyroid ultrasound showed increased vascularity, and radioactive iodine uptake was consistent with hyperfunctioning thyroid tissue. The presence of THS receptor antibodies verified the autoimmune etiology, while the eye exam confirmed significant eye involvement. The lab test revealed or resulted are indicative of Graves' disease driven by an autoimmune stimulation of the thyroid gland. So the total T4 and free T4 and T3 levels are very elevated, explaining the clinical symptoms. The TSH, in contrast, is significantly depressed, and this occurs because of the high T3 and T4, and it inhibits the pituitary gland through negative feedback. So the calcium and magnesium are within normal limits. However, when you reflect upon the increased metabolic and neuromuscular activity by their range being in the low end of normal. So although they are not flagged as being abnormal, they are important to pay attention to when we do a whole bunch of labs, because combined with the physical findings and the other diagnostic findings, they are showing that there is involvement still because they are on the lower end of normal. So, in this situation, the role of the advanced practice nurse is twofold. The patient is presenting with clinical manifestations of an autoimmune disorder, and those do and will be addressed. However, the Bible teaches us that the Lord is close to the brokenhearted in Psalms. And this is not my scripture I'm choosing, of course, but it is one I want to mention. So in Psalms 34:18, It states exactly that the Lord is close to the brokenhearted, which tells the advanced practice nurse that we have to encourage faith-based coping and address the loss of his daughter. So, in case I didn't mention it before, this patient presented also with 6 months ago his daughter was murdered and they've yet to recover the body and they're still under investigation. So, it's a pretty significant stress in his life. So you want to be sure to address the patient's emotional, psychological, and spiritual needs and offer resources for support. So although we can't give all the support in the moment, we need to make sure that we connect him with the right people to help him through this time. It is very difficult, I would imagine. Clinically, I must ensure accurate diagnosis and management are being met while coordinating care between endocrinology, cardiology, and mental health. So, education for the patient on the new medication adherence, potential side effects, and the importance of stress reduction and nutrition counseling. So, with a Christian worldview, it invites the advanced practice nurse to approach suffering with empathy, humility, and compassion and reflect on the healing ministry of Christ. So, nursing can and is, in my opinion, an act of ministry. So, in practice, this means potentially praying with the patient, offering a calm, supportive presence, and connecting him to a faith based counseling location and community support. So, this type of care will promote physical healing but also spiritual restoration. So the advanced practice nurse with a Christian worldview becomes both a clinician and a servant leader, guided by the work of God and the example provided for us. So the scripture I added down here is put your heart and soul into every activity you do, though you are doing it for the Lord himself and not merely for others. So that's a Colossians 3:23. And I think that goes back up to demonstrating a Christ-centered compassion. So we do have to educate, we do have to collaborate, we have to put all these things together. But we really, in this gentleman's, well, really in all of them, need to focus on the things that are really affecting him. Okay, so just a few questions to kind of spark some thought. So, given this particular patient's presentation of tachycardia, weight loss, and eye involvement, what laboratory test was most critical in confirming the diagnosis of Graves' disease and why? What are some suggestions you have for integrating spiritual care for this patient as the advanced practice nurse to guide him through a new diagnosis and his egregious situation for best outcome? And then what are some ideas that you should suggest to the patient as well as education provided for increasing his weight and why is that so important? So this case has some interesting twists as the patient was not only reporting his new symptoms and how they're impacting his day-to-day life, but also the events that had led up to them. He's under a lot of stress, and his diagnosis without proper questioning and testing could have easily been missed and attributed to his current stressful situation. So it's important as the advanced practice nurse to really focus on the whole person and ask all the right questions during the exam and to get the whole picture, not just the physical findings. All right, thank you so much for this presentation of hyperthyroidism.